Good evening, friends. So from the attendance, I can make out that not many are interested either in children cases or managing little tricky problems, because what we are talking now requires a lot of observation, insights on our part. And if the patient has not noticed, then to convince them that the child has a problem and needs some help. So let's begin. It's going to be a little drab topic, and I must tell you that this webinar will be available on YouTube permanently. And those of you who want the PDF of slides, Preeti will share it with you. So what is behavior? Before we talk of disorder, let's understand what is behavior. Is the way human beings or other organisms react. We know those who have pet animals, any animal has a behavior. Humans have behavior, and humans are the only one who are presumed to have intelligence. Of course, animals also are intelligent. For some people, behavior means conduct. That is how a person's actions fit society's idea of right or wrong. We are all living in a society. There are norms, societal norms of what is right, what is wrong. There are societal norms for professions. A doctor cannot come to clinic with torn jeans. My staff allows me jeans only on Saturday. They said no, otherwise they don't look good. Female doctors cannot come in shoulderless dresses. These are societal norms and these are our behaviors. The norms with which society reacts to day-to-day situations are considered normal behavior. You meet some known person, you smile and talk to them. That's normal behavior. You ignore a friend, that is not a normal behavior. Children at times behave in a different manner, which causes worry in parents and may need remedial measures. COVID saw a disruption in the families of lower socioeconomic class. Parents who were illiterates, they were working either as maid servants or drivers, had no knowledge of Zoom, may not even have had a phone which had internet connection, were suddenly plunged into allowing a child to learn on the phone, and they don't know parental controls. The child ended up watching porno without his fault. A mother came to me and said, this is a real case. Said, my son knows everything, but in exam he does not write at all. He gives blank paper and comes back. So we spoke to him. I spoke to him. I couldn't reach anywhere. I involved a counselor. This boy staying in slums, 6-year-old, tells the counselor in good English, I do it to harass my father. Why do you want to harass your father? My father does not love my mother. He does not love us because when he comes home, my mother starts getting chakkar He never takes us out on Sundays. Our neighbors go out on Sundays and go to Juhu Beach and all. We had a family meeting. The father was counseled, the mother was counseled, and the child had apparently too much energy. That is what the counselor said. He was bubbling to do something. So the father started taking them out was one. We gave him a old phone because he liked photography. We didn't want to invest in a camera for a child. Parents couldn't afford. I didn't want to get into that kind of a thing. So we had an old phone with a camera which was lying around. It was given to him to take pictures and save. And the child improved. The child came third the next year. Of course, this case came to me, but we have to identify cases also. What are the types of behavior? Like physical growth, behavior too is strongly influenced by surroundings. Every person has a genetic height. How they achieve it, whether they achieve it, depends on the environment. Parents consider it their responsibility and privilege to provide the best environment for physical growth of the child. All of you must have seen mothers coming, even with mildly obese children, that they don't eat. They're all concerned about physical growth. Similarly, it is their responsibility to make sure the child's behavior also they are directing well. What affects behavior? Environment. If you have a house where father, mother fight, where grandfather and father fight, they don't talk to each other, the child is going to learn the same thing. How the child is taught? Mother teaching the child to tell lies, not to tell lies. If granny says, say I'm sleeping. If granny calls, say something. Say I'm not here. Conditioning. How you condition the child to behave. You have guests coming in, and you know your child wants to eat everything before the guests pick up, then you have to condition the child that no, guests are the first. Positive reinforcement. When we give injection to a child, most of us keep a candy to give to the child. That is positive reinforcement. You do not cry, you get a candy. You do this well, I will give you this. You come first in class, I'll buy you a cycle. These are called positive reinforcements. And finally, heredity. I have put heredity last because it is the other four things that make the difference. So what's a behavior disorder? Once in a way, anybody can behave oddly, but any persistent and repetitive pattern of behavior that violates societal norms or rules seriously impairs a person's functioning or creates distress in others. If a child is into self-stimulation, it may distress parents more, as the child may not realize he may be young enough. The term is used in a very general sense to cover a wide range of disorders or syndromes. What we should know: what are the normal physical, verbal, mental, emotional milestones? Those of you who have internet and would like, of course, you can go on internet and ask for milestones and you will get an answer. But there is a site of mine which I had started way back in 2000 growingwell.com. This site has all milestones, what to expect. It has a lot of information on child health, including nutrition and diet of a child, which many times we are at a loss to explain, and nobody wants to go to a dietitian for a child's diet. What to expect at a certain behavior? What do you call a delayed milestone? What are the different types of personalities? At what age the child has to behave in a particular way? And if the parents are concerned, should I be concerned also? After my first granddaughter was born, my son-in-law called me. Child was 3 months old. Papa, 3-4 steel vessels dropped on the ground. There was a lot of noise. She did not react only. Is her hearing normal? Fortunately, I knew milestones. I said, no, at this age, she may not hear. It is absolutely normal not to react. And the child started normal behavior, normal milestone. Today, she is a 10-year-old girl. Scolding, beating, constant reprimanding does not work. And constant supervision is not possible. So parents, if they feel that this child is not doing the right thing, they start scolding, they start beating, they start comparing the child to other children. They start telling, look at that person. That doesn't work. It works negative. And constantly you can't be supervising the child. So then when the child is alone, child may do the wrong thing, which you're trying to stop. So behavior, as we understand, is how we behave, what is our conduct. And all of us have some basic needs, emotional needs, which we should understand before we go into the realm of behavioral disorders. Emotional security in the form of parental love is one of the most vital needs of a child. A child may not get milk on time, little grown-up child, but if the mother consoles, mother holds, mother sings a lullaby, then the child may not cry that badly. Child needs confidence in his parents. Now, when I say his, it implies his and her. I'm not going to say his, her all the time. And the home is a dependable refuge in times of adversity. What does it mean? A child is in the ground, building compound, playing, falls down. Somebody hits, the child will run home because that is for the child a place where the child is safe. Recognition and appreciation. We, even at our age, like to be recognized, like to be appreciated. Children too need to be applauded. Wow, they have to be told at times. Of course, you can't say a child wow if he's doing mistake, but then they need to be applauded. And today's highly educated parents have very high standards and they do not praise the children as they should. Their skill and achievements recognized. When parents see only shortcomings in their child, the child is likely to be very unhappy, non-communicative, and oversensitive and having problems. Because for the child, parents are the ultimate thing. So if parents only don't praise him, then who else can praise him? Many times you must have seen that if you tell very good to a child, many times children bring to us their answer sheets. The child will say, but my dad was not happy. The child needs to be independent. Child needs independence. Today's children, even at 4 years, cannot buy a dress that the mother wants. Parents should encourage the child to be independent. Today is the time of overprotection. No, at a certain age, they have to be let go and fight his own battles. And then, many times if you ask your patients, couple and one child, they have a big house, but even till age 10, the child is sleeping in their room. They should encourage decision-making process and its implementation. Make a decision, I will support you. Discipline is required in addition to independence. Harmonious life is not possible without some authority, some order, some limitations. You can't go beyond this. So discipline and authority are very important in a child's life. They need an authoritative figure and they need discipline. Understanding, reasonable. You can't be unreasonable to a child, and you should be just. It's not that your 98% scoring is bad because cousin son got 99% or father had got 99%. Then there is a very big trigger for behavioral disorder is different disciplines of parents and grandparents. If parents are little rigid, for the betterment of the child, grandparents are over liberal. And today's time, if father and mother think differently, you must have seen that father wants child to be a doctor, mother wants child to do an MBA. These conflicts don't happen at the age of 18, 20. They happen in the childhood only because both are seeing left and right. And all this affects the child in a big way. Discipline, what is discipline? Training that corrects, molds or perfects the mental faculties or moral character of the child. Control gained by enforcing obedience. Child wants to be obedient. Child wants to be controlled by you at that tender age. Of course, at a certain age, after 7, 8, 9 years, he may not want that control, but when it is required, it is required. An orderly or prescribed conduct or pattern of behavior. Self-control, meaning restraint exercised over one's own impulses, emotions, or desires. A father may be very angry, may want to hit at a child, but the father has to learn to exercise restraint. All these things, if not followed by the families, lead to behavioral disorders at a very early stage. Play activity. It is through play that a child grows. Children learn through playing because when you play, you will not always be a winner, you will lose. And you learn to tolerate the frustration of losing. So play activity is a must. Physical needs, emotional needs, and social needs. Children work out their emotions through play. When you send children for counseling, the best counseling they do is play therapy. In a counseling session, a child picked up a doll of an elderly person, something like a grandfather, and started hitting the doll. And the counselor was shocked. A very close consultation was held. Parents were told to observe the child and the grandfather's interaction. And they learned that the grandfather was sexually abusing the child, a 4-year-old child. So all these things are happening in our society. And as I said, children learn to accept defeat, learn to tolerate frustration. What are the common precipitators for a behavioral disorder? Child was normal till this age, then suddenly this happened. Did something happen? Was there a death? Is there a major event in the child's life? Commonest you will find, a child till age 2.5 is not thumb sucking because the mother had taken sabbatical from work. At 2.5, mother started going to work. The minute she stepped out, child started thumb sucking, and which will stop only when the mother enters. Tremendous insecurity. Common precipitants are witnessing accidents, disharmony between parents, because disharmony doesn't remain silent. Parents have to be taught that you should fight your battles in a room, not in front of everyone. Beating by the teacher. Many children, you must have heard that teacher beat up, the child urinated there only, and from next day, child reaches the school gate and vomits. And sexual assault. The worst that can happen to a child is sexual abuse. Physical changes, not what is normally expected, but all my friends are growing tall, I am short. And then there is a mother who says, look, you've gone on your father, you remaining short. So parental role in behavioral problems, 99% of behavioral problems in children are caused due to parental influence. What all parents can do? Rejection. One of the parent or both the parents wanted a girl, but they got a boy, or wanted a boy and they got a girl. They are bringing up the child, but in the mind, they have rejected the child. What rejection causes? Feelings of insecurity, feeling of isolation, attention seeking, hostile behavior. This child realizes that he is not wanted. So he does acts to get attention of parents, become very hostile, very negative, unable to give and receive affection because he's not getting anything. And after some time, after 1 year of this, you can't suddenly start loving a child. So the child ends up not being able to give affection also. Overprotection and dominance. Very well-educated parents, very rich, 4 cars, 6 servants, 1 child. Submission. They dictate children. Play therapy has an advantage that it is unstructured activity for a child. It induces thinking by the child. Now, today's mothers know. I have a lady who comes to me. She teaches abacus. And she was telling me that she has good number of students because several parents now think that since I did not learn abacus, my child should learn abacus. So children today plan a child's life from age 2, 2.5 onwards. There is nothing unstructured. The child becomes submissive. Child doesn't think. They feel inadequate because for everything they have to look at the mother. Lack of initiative, because initiative is being taken for him and her. No? Tendency to be in passive dependency on others. So overindulgence and dominance leads to this. Jo mangoge milega. It is the children become selfish demanding with inability to tolerate frustration. Child of 4 years told the mother, "You have never done birthday for me. Now I want birthday at McDonald's. And I will call entire class." Parents had to do that because otherwise child will be very moody, crying and all. And they become rebellious to authority. Excessive need of attention. If we, when we start practice from day one, start getting a full OPD, no, that will be given as overindulgence. We won't be able to tolerate 5 minutes without a patient in the clinic. And then there is lack of responsibility. Perfectionism. Some people are perfect. I was merit list holder when I did my 10th. So my child should be like that. I don't know how many of you now, or if you are 60 plus, when your children were small, have gone to open days in school. There are mothers who fight with the teacher for every half mark that the child has not got. They want perfectionism. They want child to be perfect. What it causes? Unrealistic ambitions for the child. And child internalizes parents' unrealistic standards. My child will come first in JEE to get IIT Bombay. And child starts believing that. And when the child feels, you must have read that a lot of deaths are occurring, suicidal deaths, when children are preparing for IIT. Most of them are internalizing parents' unrealistic ambitions and then realizing later that they will not reach anywhere and committing suicide. And inevitable failure, because naturally they can't achieve that, no? Continual frustration and guilt, devaluation. One distant relative of ours told us, I said, "What is your son doing?" "No, he's in IIT." "Which IIT he got into?" No. He's in Kota, preparing for IIT. Okay. And this lady, when he went to Kota, gave a party, distributed sweets and everything. Within 2 years, the child said, "I want to give up all this or I'll commit suicide." So came back home and now doing nothing, just alcohol and smoking. Faulty discipline. As parents, we are not always right. Do we realize we are giving wrong discipline? One parent or both parents will be over permissive. That leads to insecurity and antisocial aggressiveness. Children become very aggressive if they're permitted whatever they want. Or on the other hand, discipline is very rigid. You have to be home by 8 p.m. 5 past 8, you sit outside the door for 2 hours. Or 9-year-old child and wants to stay overnight. You don't know whose house, you don't know the other friends' parents, and you say, "Okay, go." Or inconsistent. Today I am allowing because I am busy myself. I have no time to listen to what child wants. But tomorrow I am having free time and I analyze that I don't allow that. Sibling rivalry. Nowadays, whenever a patient of mine has a second child, second time pregnant, I always ask them first question, are you preparing the elder one for the upcoming child? Otherwise, it can cause major issues in the first child. Direct or indirect hostility. They are hostile to the younger one. They may beat up also if the child is found alone, because suddenly mother has no time for them. Insecurity, tremendous insecurity, lack of self-confidence, and regression. The child was very smart till the younger brother came in. Parents didn't realize, they ignored the child. They were after the second one. And unfortunately, if they wanted a boy and first was a girl, then definitely the child is going to get regressed. Children who were talking normally will start to stammer. Children who had a tremendous bowel control will start soiling pants. This is regression, and we have seen real cases in life. Marital discord and broken homes. We always read in books, we watch in movies what happens in divorce. Indian society is still not ready for divorce. How they manage children is a sad thing. Anxiety, tension, insecurity. If the child was attached to father, but father, when moving out, doesn't want to take the child because he is getting married again. Tremendous insecurity. And if the home base is not secure, then they start evaluating the world as a dangerous and insecure place, because for him, his house is the world. And today, if the house is not secure, conflicting loyalties, when divorce is about to happen, both parent wants children to be with them in their favor. And then there's lack of adequate model for ego. All of us need an ego. To grow in life, we need an ego. But if both your parents only are not supermodels for you, how will you build an ego? Okay, internalization, as I told you, start believing or inculcating the behavior of parents. So if father is a thief, or if father is somebody who smokes or drinks alcohol, beats up mother, all these are unethical and socially desirable values. Police comes for father, takes him away. He gives bribes, the child sees that. All those things children pick up, and they have major issues of themselves. Contrary demand always said one parent wants child to do something, second parent wants to do something else. Confusion, self-vision. Because the parents, when they want what they want, no, do not think what are they talking and how they are devaluing the other person. So there are a lot of behavioral problems. We'll be talking, if you are interested, next week we'll talk on ADHD. But there are certain body focused repetitive behaviors which are more common in a practice. So I'm starting with that today. Anything happening persistently, causing some impairment to life, like nail biting, interferes with daily activities, causes physical harm, could be giving bleeding, infection to the nails, and impacts social interaction. If you're biting your nail, you don't talk at all. Lack of control, cannot control that habit. The body focused repetitive behavior cannot be controlled by the child voluntarily. And distress. It causes distress in self, it causes distress in others. When the child grows up, realizes what he or she is doing is wrong, but cannot control it, causes distress. Many times these behaviors cause distress in parents more than in children. What are the common ones? Thumb and finger sucking, breath holding, self-stimulation, head banging, nail biting, onychophagia, stammering, and hair pulling, trichotillomania. Let's take thumb and finger sucking. Sucking, we know, is a very instinctual behavioral pattern. If we are examining a newborn, we stroke the finger near their angle of the mouth. The child may turn towards your finger to suck. So sucking is a tremendous instinct. But then as children grow, it goes off. Most young infants suck on their fingers for varying period of time. They may suck thumb, they may suck fingers. This is a normal behavior till it happens for a certain length of time. Constant thumb sucking is strongly related to emotional satisfaction of the child. The child feels emotionally satisfied. Which child needs emotional satisfaction through thumb sucking? Who doesn't have emotional satisfaction in the family? Like mother going to work, and most mothers, what mistake they do? They try to leave the house when the child is sleeping. I tell them it is wrong. Children understand. Even a 1-year-old child, if you tell no, you're working from home, mama has to work, don't disturb, the child will understand. So talk to the child. Finger sucking will not have any detrimental effect on the position of permanent teeth if discontinued before eruption of secondary teeth. It's only when it continues beyond 5, 6, 7 years that it causes protrusion of teeth. Majority of children give up this habit by the time they reach school age because it is embarrassing, except in the moment of severe stress. So a child had a habit of finger sucking, gave up. Child is 8-year-old now, and the teacher is hitting somebody for some wrong activity, and which child feels he may be next. He may just start sucking fingers that time. Thumb sucking represents a greater problem to parents than to the child because, as I said, parents get more distressed than the children. History usually reveals that child does not do an unusual amount of thumb sucking. It is the parents who are more worried. The child may benefit from positive reinforcement here rather than negative reinforcement. So what people do, they put red chilies, they put something bitter. But children are smart now. They will go and wash it with soap and water. And then they start. Parents actually, parents thinking is actually very wrong. They think that if I tell people, no, look, he's 6-year-old, is still sucking thumb, the child will stop. The child may do it as a challenge to the parent. Self-stimulation. Quite common. Usually consists of normal self-soothing habits and arises in early infancy. Such behaviors appear in two forms: rhythmic habits like rocking, head rolling, and head banging. Many times when parents are putting children to sleep, they put them on the lap and they keep rocking them. Then playing with genitals. Initially, we say it's a curiosity. Yes. Playing with ear lobule. A child has got a bottle of milk in his mouth and he's rubbing his ear lobule. Yes, all that is self-stimulation. Appearing in the second half of the first year, after 6 months of age, these behavior usually occur at the time of fatigue, when they are sleepy or they are frustrated, and serve as a comfort to the child. Genital exploration or manipulation. The extent of this behavior is directly correlated with age. Most boys keep playing with their penis. In an infant or young child, genital manipulation is a manifestation of curiosity, nothing beyond that. In a 3 to 6-year-old, expression of normal interest in sex. But this should not arouse concern if the child is outgoing. Parents should explain to the child that it is not right. It is not done in society. When you walk around, do you see people doing that? And the child is most likely understand, because children today are properly clothed, so they can't touch the genitals. The child is outgoing, sociable, and not preoccupied with activity. It will not arouse any concern. Excessive stimulation usually indicates underlying high-level anxiety. But this may not be genital or family conflict, or maybe a sign of some emotional disturbance. Excessive playing with genitals, despite explaining, and a child is of average intelligence, then better to refer to a counselor. So, management of concern for rhythmic behavior, basically head banging, rocking. We have to make sure, other than genital exploration, we have to make sure that child doesn't injure himself or herself. And when the behavior is started, we don't want to pull off the hand all the time. Like you pull off the thumb from a child's mouth, then the child is going to put it back again. Now I had a very strange case which initially I did not believe. This was a girl of 18 months, and the mother came very worried to me. The girl was once lying prone, sleeping, and girl had passed urine, so they had removed her diaper and they had not put on the new one, thinking when she wakes up, we'll give her a bath. This girl somehow accidentally rubbed her private parts to the mat down, and the mother said, I was shocked. She almost got the child got an orgasm. I never heard that children can get orgasm at that age. So I couldn't believe it. I thought she's just over concerned. Next day, she brought the video on the phone. And orgasm or not, the child was actually having a very pleasurable moment for some time, jerking. Of course, we spoke to a pediatrician, but what we told her was not to leave the child without a diaper or a panty anytime. The child was not touching herself. It was just the rubbing of the mat was causing, and we removed the mat and put it a soft sheet. And fortunately, it stopped, because I am still at a loss to say how I could have managed that. Then this problem that I told you of 10-year-old sleeping with parents, how I came to know was I was talking of the parental problem of no time for sex. So I said, child is 10-year-old, he is already 60 kilos. In a year or two, he may want to masturbate. Then what are you going to do? Then they gradually talked to the child, and child was very happy sleeping in a separate room. So it has to be explained. Children have to be convinced. They have to be brought on the table and then made them to accept. You can't force them to give up a habit. Nail biting, this is a habit occurring in school-going children, but may last even in late childhood. See, many times it starts because the nails were dirty, and then it continues. And then nail biting, if you see in a child, only when stressed. Many times you have children coming to you and you look at their fingernails, they are bald. The children are biting. in tremendous stress or anxiety, they bite very fast, very ferociously. All this shows some internal insecurity, and you should talk. If you are not close, then you should ask the parents which one of the parent is closer to the child, where the child is likely to give out everything without getting to hear that, oh, you are so sissy and all that thing. It could be triggered by boredom, excitement, worry, or embarrassment. But if it is boredom, it can be given up very easily. But it is a question of insecurity, then yes, it is difficult to get rid of. How to handle? Ignore it. Older children are more easily motivated to stop nail biting, especially girls, because it doesn't look good. And if you allow them to use nail polish or nail paint, they may give up it very easily. Breath holding attacks. Very scary, alarming to the parents, seen mainly in toddlers. What they do, the child is usually very intelligent, easily frustrated, and reacts in a dramatic way to gain attention. So they take a deep breath as if they are about to cry, but then hold breath. Rarely occurs when the child is alone. He needs an audience. So you can imagine intelligence comes in toddlers also. An attack often starts with the child taking a very deep breath as if he were going to scream, but then holds the breath in. So there is no further input coming in. The face becomes red, and then may become bluish cyanosed. All you have to do is break this cycle. Attacks aren't usually dangerous, but sometimes it may turn into a seizure or a short period of unconsciousness. Slapping the child is usually ineffective, but you have to teach the parents. A good trick is to hook a finger over the back of his tongue and pull it forward, making it impossible for the child to hold the breath and let the air go in. However, this should be done early in the attack before the child clenches the teeth. If the attacks are controlled early, they seem to disappear. A combination of this is frustrating activity. Child is frustrated on something. Child is playing with the toy. You pull away the toy, child will get into a breath holding attack. Most children grow out of these by the time they reach school. Temper tantrums. You must have seen in malls, children rolling on the floor because father or mother didn't buy them what they wanted to buy. Sudden displays of uncontrolled rage, seen under the age of 4 years. It may last from a few seconds to minutes, depending upon how the child is handled. The behavior may take the form of screaming, crying, or lying on the floor with head banging and heels rolling. Children of this age are generally not able to control their emotions. This happens mostly in children who are initially overindulged. I'll give you whatever you want, and later on denied, because as the demands keep increasing, parents realize that we are spoiling them. To release the anger and frustration in the only way they know how. More so if the mother does that in the house. They're unable to tell their parents what is bothering them because speech is difficult. If they cannot get their way, then they will throw tantrums. How do you handle them? Keep calm. We always tell that walk away from the child, because The child needs an audience and they want to embarrass the parents, so they do it when it's a crowd there. Find out why the child is behaving this way, and if something you can put right, please put it right. It's because of something that he should not do. It is wrong. Then don't give in. Just walk away. Let the child do what the child wants. Because children, if they're head banging, they are careful. They don't want to hurt themselves. Never physically punish, and this will enrage him more. So in the mall, a child is doing this, mother goes near and then hits. Many times we have seen children even giving bad words to mother and father. Do not teach, because when you hit, no, you are actually showing physical show of anger is permitted. The child will hit back. You know, there is a way to hit a child. I tell some parents used to hit children. I said, how do you hit? If you want to show anger, no, give one slap on the back, never on the face, never on the head. But if you constantly keep hitting, no, till you are satisfied, you are telling the child, sorry, you're telling the child that when you are angry, it is right to hit. Stammering. Hesitant, repetitive speech causing an interruption in the normal rhythm of speech. We all have seen stammering and don't need to define that. But then it is severe. It attracts attention and causes embarrassment to the child because it interferes with the communication of the child. In some cases, sounds are repeated before the sentence begins. The stutter even before the word is eventually spoken. In others, the child may stammer at the first word, cannot normally complete the sentence once the initial hurdle is overcome. Once first word comes out, then the sentence is full. We have to just see, is there a tongue tie or not? Otherwise, this needs little confidence in the child. A child knows precisely what he wants to say. It's not that the child doesn't not know. That's why he's searching for words. No. But involuntary repetition of sound occurs. Most common between 2 to 6 years of age. 3 times more common in boys than girls. Most children stop by 4 years of age. Again, a normal activity of childhood. What you should be worried about, a child who had started talking normally stammers now. That is a worrying thing. The child is worried about something or the child is angry about something. Problem begin. Now, if a child is stammering, no, we have to tell the parents when he starts talking, look away. If you keep looking at him, he knows now you were expecting a word coming out, then the stammering will be more. This should convince us that stammering is more emotional than physical. Physical, if there is a tongue tie, well and enough, but otherwise, it's an emotional barrier. A study has shown that children who stammer generally have a great deal of domination by parents or people in the house, too much of discipline, overprotection, and perfectionism at home. So any problem, please look into the parents and see what are they doing. Watch out, a parent may be responsible for a child stammer. Child stammer should never be mentioned to him. Leave aside others. People telling their cousins or guests, look, he still stammers. The child is never going to come out of it. Mild cases recover on their own. If it's extremely worried, then refer to a speech therapist. The child continues to stammer by the 4th birthday, definitely needs to see a therapist, because by that time they should be talking very normally. A very small percentage, as I said, tongue tie, which needs correction surgically. If the child started talking normally and started stammering, then it is a serious emotional problem. There is always a trigger, identify that, and then correct that trigger. Refer for counseling. That's all for today, friends. I was not sure I'll be able to complete it in 1 hour. And those of you who are not on Inches Academy group on Telegram, please join. We are having some very wonderful interaction. So there are a lot of questions. I will do one thing. I will cover these questions next time before we start our next lecture. And please, 29th, there'll be no webinar. I have a wedding in the family. So I will send, of course, the announcement, but we will meet in July once again. Preeti, please save the questions.
Yes, sir.
Yeah. Dr. Mukesh Patel, the subscription thing is coming. It's in the final stages. So maybe by end of July, I'll be able to offer you. Bye.